Thanks for joining me for another episode of the Your Longevity Blueprint podcast. Today, my guest is Paula Anderson, who is a qualified orofacial myologist and a registered dental hygienist. She has worked in the dental profession for over 20 years. After taking several continuing education classes on craniofacial development and sleep disordered breathing with her husband, she came across the field of myofunctional therapy. I hope I'm saying all this right.
You are. You're doing
She
good.
instantly realized the application of this field in everything that they do in dentistry. She also realized that her entire family, including herself, could benefit from this therapy. From mouth breathing and snoring, ortho relapse, and TMJ, she dove in and learned from the best in the field. She's always loved holistic health and working with a team approach to whole body health, and myofunctional therapy is her contribution in this field. She is IAOM, International Association of Orofacial Myologists trained, and is also a member of the International Association of Orofacial Myologists. She's also a certified Myomunchie practitioner, and she's lived in the Quad Cities, so she's local Iowan here too, her entire life. And she and her husband have 4 daughters, 2 son-in-laws, at least 2 grandsons, and several fur babies. They also run a successful dental practice, Anderson Dental, and in her free time, she enjoys spending time with her family, especially at her cabin in Wisconsin. Welcome to the show, Paula.
No, thank you for having me.
I wasn't sure if you had another grandbaby since we talked last. I know there was one coming, so
Yep, I have the two. Yep,
two.
boys.
Congratulations.
Thank you. Thank you. Thank
Well,
you.
I told you when I started working, well, not me, but when my son started working with you, that eventually I wanted to share his story and his journey, right? Kind of after he was like better, and he's still kind of in the process. But
Yes.
that's why I brought you on the show today. So I just kind of wanted to share how you've supported us. And for our listeners to kind of fill in the audience to give a little backstory here, many have already heard that I had a very complicated delivery. And it was really a miracle that I could even make breast milk. Thank God I could, because I lost so much blood. I think because I had blood transfusions, my fluid volume, was repleted. And so I was able to make breast milk. But William didn't latch well. And from a very, young time in his life, I thought something isn't right. I thought for sure he had a tongue tie. And at that time, all the providers that I had consulted with, his primary care, his dentist, even the lactation consultants at the time, disagreed. They're like, no, I don't think that's the case. And they gave me other strategies and nothing really worked well. And I still regret that, like not pushing to get more help at that
Yeah.
time, but it is
Yeah.
what it is. You
Yeah.
can't go back, only move forward. But I will say at that time, his chiropractor and I agreed that just again, something wasn't right because, and that he probably had a tie because he didn't latch right. Now he got breast milk, thankfully, 14 months, right? He got the benefits of the breast milk, but he didn't get the benefit of breastfeeding, and that his oral cavity,
Mhm.
which you're the expert on this, not me, but didn't quite develop
Yes.
as best as I believe it could have.
Yep.
So then years later, his teeth were crowded and they're almost kind of, like curving in a
Yes.
little bit there.
Yep.
And his current dentist said, I think he has a tongue tie. And I was like, what the
I know that.
heck? I was like, I knew
Yep.
this. I knew
Mom,
this.
that's a real thing.
I
It really is.
was like, I knew this all along, but yet no one, early on addressed it. And so I do have regrets, but again, I have to move on. So long
Right.
story short, that dentist referred us to see your husband, who specializes in a specific technique for releasing tongue ties.
Yes.
And he required that we work with you, right? The myofascial
Yep.
specialist.
In preparatory of that procedure. Yeah.
Yes,
Yeah.
before and after. And so it turns out that William did have a stage 4 tongue tie. He had an upper lip tie and he had some buccal ties as well.
Yeah.
Now, Eric, my husband, and I do have MTHFR genetic variants, and I know that can be a risk factor for these sort of ties in a child. And so, again, looking back, I feel like the signs were there, but most importantly, we had the knowledge and now we have the resources, right? So that we could get this taken care of. So I wanted to bring you on after his releases, but the story
Yeah.
started much earlier. And so I just needed to share that backstory with the
Absolutely.
audience.
Yeah.
So many times releases are done, the wrong way, and there are different surgical techniques, and that's not exactly what the show is about. but
Right. Right.
but without proper myofascial therapy,
Yes.
I will say even the releases can be, what do you call it? The ties can come back, right?
Yeah, they're less than successful, right? Your whole
Yeah.
your whole goal is to have improved function. And yeah, the muscles have worked the way that they've worked and developed certain patterns and habits way before even birth. In utero, they're swallowing, their tongue
Yeah.
everything develops a certain way. So in what we're learning is literally, the earlier, obviously, the better,
Yep.
and education is key because, I tell everybody, be very patient with your providers because at one point I was one of those providers, my husband was too. Like we looked at things and we knew we were seeing something, but weren't quite sure what,
Mhm.
and I use the example all the time, like I seen mouth breathing and knew that there was gum disease issues or tooth decay issues that I knew was a result, or at least a big contributing factor would been the mouth breathing. And would say, this is due to mouth breathing, and kind of look at parents like, okay, get them to stop mouth breathing, like shouldn't just be so easy. Why can't they just close their mouth? And you start to kind of learn that it isn't that easy. If it was that easy, everybody would do it,
Well, and
so
that's what brought us to you. I mean, literally, like William, and I can tell, and I should have watched more closely that he was mouth breathing, but at night he's like, his mouth's just hanging open, and and
yeah.
so
And
getting the releases done, that's
yeah.
one goal, is for him to be able to better, and he already can, close his mouth better. And so again,
Mhm.
that kind of brings us to you. Thankfully, we had your assistant.
Oh,
So
yeah.
I want to get into why mouth breathing is so bad, but I think we should rewind and maybe
Yes.
you share with us. Well, A, I shared a little bit in your bio, but B, expand on that, like how you got into this field and what myofascial therapy really is. And then we'll talk about kind of what it treats. So first, you tell us more of your story and what you do.
Yeah, yeah. So being a dental hygienist for 20 years, I said my husband and I have a dental practice, and there was a dentist in our office who used to do sleep appliances and traditional sleep appliances for adults. And he was retiring, and he said, "Hey, would you take over my patient pool and help us with, take care of these appliances for us?" And husband and I were like, "Yeah, absolutely. We'll do that." So in our education of learning more about how to identify patients with sleep issues, right? Breathing issues, and learning how to do those traditional appliances. They're called like mandibular advancement appliances that dental offices do for adult patients with sleep apnea. We came across this huge, and there's just so many more treatments for patients. It used to just be a CPAP or mat appliance. And so now we know there all kinds of treatment, and myofunctional therapy was one of those supporting treatments for adults. And in learning about myofunctional therapy and how it can help treat sleep disordered breathing in adults, like how it helps keep airways open and help patients then to get deeper, more productive sleep, your brain just goes, well, and as a hygienist, we work preventatively, and we work, so you just,
Mm-hmm.
how do I get ahead of it? How do I prevent it? And it literally just keeps taking you younger and younger and younger to go like, how do I guide this? How do I open airways? Okay, this is how, I help keep an adult's airway open, but things are formed, right? Your jaw shape is kind of your jaw shape, and that airway space is kind of your airway space. And that's what we're learning now, is there are some appliances to help change that. But what if you could guide it? What if you could, help do that sooner and sooner? And so learning that is what got us involved in doing that piece of it. And honestly, once I learned it, I couldn't stop.
There's no turning back. It's like once you
There's
know, yeah, yeah, yeah.
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 And I remember honestly, my first teacher said that I'm going to show you something, and once you see it, you can't unsee it. And I went back thinking as a dental hygienist that, okay, great, I know this, I'm going to be able to pass this on. And it just became kind of like you couldn't turn away, and educating patients on like a different way of doing it. And like I said, then patients be like, okay, if this is me, what do you think of my child? And then once you're talking about the child, but it's like, well, what about my baby? And the education just kind of grew from there. So yeah.
So what is myofascial or myofunctional therapy?
Okay, so it's to support, it goes by another term too.
Yeah,
So
yeah.
oral facial myofunctional therapy, I think best supports what it is. It's been
Okay,
shortened to myofunctional therapy.
sure.
Oro meaning mouth, facial being face, myo being muscle function. So how all those things function together. And the therapy to support optimal function of all those muscles. So um, all the things supporting what the tongue should be able to do, right? Your breathing, your sleeping, your growth and development. Um, what else was I going to say? So breathing, speech, eating, all those things,
Sure.
that the mouth should be able to do, but optimal function to help support those things.
Well said. Okay. So what does it treat? So we had a specific case like that we needed you for, but I know we are one of probably many different
Yes,
cases or
yes.
types of patients you work with. So can you kind of answer that? What all can you treat, help treat?
So we always say, like, I'll start with like the younger population, right? So you touched on it for starters. So, the infants or pre-crawling stages, patients are, you're going to notice feeding first because you're doing it every 2 hours. And it's a high pressure, high stress moment for a new mom. So when there are myofunctional concerns or oral function concerns, feeding seems to be the biggest red flag that you'll notice at that phase. When they get a little older, breathing, mouth breathing, sleep and snoring, you might start to notice that in, an older child that, again, things may not be functioning quite properly. My adult patients, I always say kids are like beautiful compensators. They can do all these strategies. I mean, and that's what they gave you, right? They gave you feeding strategies to help make sure your baby puts on weight, but it might look like a breast shield, or it might look at like, a different position, and those are compensated strategies. But as adults, we can't compensate without starting to feel the consequences of those compensations. So my adults oftentimes know they have sleep disordered breathing, right? They know they're not getting restorative sleep, or they have an actual sleep apnea diagnosis, or they're starting to suffer from like headaches and TMJ pain. So those muscle imbalances are resulting in something that they're feeling pain-wise, headaches, TMJ, things like that.
Sure. Well, the next question I was going to ask her, what are some cues to parents that they may need your help? But you pretty much just answered that. So it's
Yeah, yeah,
problems feeding,
yep.
snoring, more the mouth breathing, and you just also said even in adults, headaches, TMJ,
Yes,
whatnot.
yeah. And like what brought you to, your dentist too, like there's not enough space going on here. Like I can tell teeth
His
are kind
teeth, yes, yes.
yes, are crowded. Things don't, look like there's going to be enough room for permanent teeth. That can be a sign to grinding, that wear and tear on the teeth. Sometimes for young parents, they notice the mouth breathing, the grinding, the less than optimal space issue can be a big red flag too.
Yeah, so for parents, if you're listening, you actually want your little ones to have literally gaps between their teeth, even if it
Yes.
looks silly. That's a good thing.
That's a
That means
good
they
thing. We
have
want
room.
spaces all over. Well, think of it. Your permanent teeth are, 2-3 times the size of your
Yeah.
primary teeth. Like you need to go into that with as much space as possible.
Yep. And William needed more space for sure. Okay.
Yeah.
So what are some of the goals? And maybe because obviously this revolved around, William, what were some of the goals you had for him? And maybe could you kind of walk us through, like, because I don't totally remember all of it because it was a bit
Yeah.
overwhelming, but from the very beginning,
Yeah.
like your assessment of him and the exercises you provided him and kind of what those goals were for him. And then we can talk about just kind of goals in general of myofunctional therapy, but let's talk
Yeah.
about, so for again, for parents who are listening who are thinking, oh my goodness, maybe my kid has that a tongue
Yeah.
tie
Yeah.
or
Yeah.
whatnot, lip tie.
Yeah.
What were you looking for in him, and kind of what were some of those first exercises and goals you had for him?
Yep, yep. So there are 4 main goals that will always kind of circle back around to with myofunctional therapy. So breathing through your nose all day and all night, lip seal, which has more to do with like the muscle balance as to how your lips come together, whether it takes effort or no effort. Tongue posture, which is having the tongue
Yeah.
rest fully in the palate too. I think that's a
Yeah.
piece that sometimes as you're searching online, we'll talk about like that spot placement, but we don't just want the tip of the tongue resting behind on the roof of the mouth, but we want the whole tongue resting in the roof of the mouth, and then proper swallow. So during in that proper swallow, again, looks a little different for an infant than it does as they get older, but we want to have a tongue that rests fully in the palate, and then the tongue that does a full swallow or peristaltic based swallow without having to use a whole lot of compensations, facial compensations, neck compensations to help with that swallow. So like during the eval, it can start with observing their breathing. You know, is their mouth open? Is it closed? How long is it closed? You know, how long can they breathe through their nose before you see if they have to take a breath? Or are they good at doing that piece of it? You know, can they breathe through their nose efficiently? And if they can't, then there's some problem solving there too, because first and foremost, we want to be able to breathe through our nose. Secondly, is like when they do close their lips, we talked about lip seal, like, and William was one of those, you know, those cases that it almost looks like the upper lip is a little shorter. And when you go to close, then it pulls, right? You see, you know, mentalis strain, you'll see chin strain, you'll see lip strain in patients. If you have them do it for a longer period of time, you'll see tension start to form because it's not easy for them.
Is that
So
because of the lip tie? And then once that was released, his lip drops a
it
little
can
bit? Is
be.
okay.
It can be. And again, it can be, there's three main reasons. So strength, mobility, and space. So when we talk about the lip or the, you know, the tongue specifically with the space, but is it strong enough? Is it mobile enough? And is there enough room for it to do what it needs to do? So yes, in the case of a lip tie, you know, you might have a patient move their facial muscles mid-face, smile around, and this doesn't move a whole lot, or it appears shorter, so it doesn't want to close, and they close, and this looks like it's causing more strain. Tongue posture, you know, we'll do a few tips and tricks to see like where does that tongue sit? Is it just the tip that can reach? Is the back reach? And again, is it easy? Does it stay there? You know, when you, because you can do some of these things. I think I mentioned it in the eval. I think some patients head into this thinking all those things are wrong, right? You know, they can't breathe through their nose, the tongue, I check, it's on the bottom of the mouth at night when they're sleeping. You know, sometimes it isn't all the things. Some patients breathe through their nose pretty good, you know, and that's not a problem during the day, but then you go to lay down at night and then the congestion sets in, the tongue can't sit on the roof of the mouth. And again, then, you know, the troubleshooting sets in, like, is it a strength thing or is it a mobility thing? Is there a tie present that we might want to look at too? So
Sure. Can we stay on tongue posture for a second? So this was all new to me. I mean, I obviously I practice functional medicine, so I was like all in. I was like, yes, we need this. This sounds great. This sounds like what we need. Let's do it. But
yeah,
but the actual, you know, exercises, I'm thinking, how am I gonna get, he's almost 5 now, but he was, you know, probably freshly 4 or something at the time, really young kid who I'm biased. He's my son. I feel like he did his exercises, I mean, better than I could have. He was very
yeah.
diligent and he did a good job. And I imagine that can be a challenge when working with children, is getting them to do
Yes.
these exercises. But
Okay.
I know the majority of the listeners are just listening, they're not watching. But for those who want to watch or who can see this on YouTube, can you show, especially in regarding, you know, in reference to that tongue posture, some of the exercises like that you had William do to get his
Yeah,
tongue to rest on the roof of his mouth? Because, you know, I don't think about these things. I think my tongue is in the right place, but, you know, like
yeah,
I wasn't
yeah.
thinking about some of these things. So can you, for the listeners, give some examples of exercises you use with your clients to help achieve some of those goals?
Yes, yes. So I know some people can see. So if you are watching it on YouTube, I always kind of show people the mouth model. And we're looking to touch, you know, 3 different points on that palate with the tongue. But to get your tongue in that correct, you know, beginner spot, sometimes we'll do exercises like saying N. So we'll have them like brush the tip of the tongue and say N, and that should get them somewhere close to that first spot, that ideal tip location. And we always kind of start there first, usually because that's where the tongue is most mobile. Even if there's a restriction and a very serious restriction, you can usually get the tip of the tongue to elevate the way that we want it to. And most of the time, you know, saying that letter N kind of promotes them to go to that spot. We might use things like toothbrushing, so stimulating that spot behind the front teeth and having them aim for it. We've done food. You can stick, you know, peanut butter or, you know, something behind the front teeth and have them feel for that area. But oftentimes the letter N will promote a child to get their tongue at least elevated to that spot for starters. And then from there, strength. You'll see lots of YouTube videos and myofunctional therapists on Instagram doing lots of like tongue clicking. That is a cornerstone exercise. for patients to do to improve, again, depending, no matter what the range of motion is, to start with clicking. And I'll even say some patients, you can tell that awareness for that isn't even there. So you even have to kind of back it up a little further and do some more awareness exercises. And I say that because it's hard to think in terms of space, but when you see your hand and you look at your hand, you can look at your hand and go, okay, I'm gonna count, and you touch my fingers, I'm gonna move my hand, I'm gonna see how that moves. But if you're not in front of a mirror, or if you're a young child, like where your tongue rests in your mouth is such a foreign concept. Whether you're breathing through your nose or your mouth, sometimes too, again, parents are like, well, why is that not something you can, that's not something they've thought about before.
Right.
And telling where the air is coming from can be kind of a hard concept. So sometimes you have to back that up a little further and be like, this is how you move air in and out of your nose. Blowing your nose, sometimes for little kids, is a very challenging
Yeah.
skill they
Yeah.
have yet to learn. So some of those are like those basic ones. Tongue clicking, brushing, the letter end at least gets that tip up to that spot. We did a lot of awareness, right? Checking in day and night. I'll have parents go in and do a little chin pull down, call it, and see if the tongue is up when they're sleeping. That's a real good one. I mean, for infants, we do that one quite a bit to see if the tongue posture is where it should be.
And you had us get these things called myospots that were almost
Yeah.
like they weren't candy. I think they were xylitol or stevia based or something, but a little teeny dot that we would put, it almost adheres via suction right
That's it.
behind the teeth on the upper palate there. And
Yeah.
then William would touch his tongue to it. Right. So that was
It
his
sticks for
cue
like
or
an
his,
hour. Yeah, it sticks for like an hour. So those are great too, because if you talk, right? So we'll do some other exercises where they'll balance a band, but at least with a myo spot, like the second they can stop and talk, and as soon as they're done, close their lips, their tongues can't help but play with that, that strawberry flavored dot you just put on the roof of their mouth. So it automatically works on elevation.
yeah, but that's another good one where I'd never had braces. So I didn't even know what ortho bands were. I didn't
Yeah, the
those little
bands we
things,
gave
but
you.
yeah, but so you would have him put one of those bands on the tip of his tongue, and then he'd hold that to the spot for so many seconds, a minute or
Yes.
something. I don't know how long it was, but
Yeah.
that was good for him. And I mean, he was doing these, multiple times a day. So he
Yeah,
got, yeah.
that's the integration piece too. So we talked about like goals and phases. Like sometimes phase one is just being aware. Like this is where your air is coming out. This is how you breathe out of your nose. This is where your tongue should rest. And then getting some of that strength in place and some new patterns. So having the tongue elevate instead of wanting to rest down before you do a tongue tie release. So this is something that our field is still growing and developing, is understanding how much therapy should be done before a tongue tie release is done or before a release is done. What should be our goals and proficiencies before that release is done? And then how do you meet that with every age group? So I think, universally, we're all kind of on the same page when it comes to like older children, but we're even still like with younger infants and toddlers, like, no, we still need therapy beforehand to have that muscle understand what it's going to do. Otherwise, we do the release and we as therapists are not surprised the muscle didn't do anything. It didn't magically elevate to the palate just because you did the release. So how much therapy should be there beforehand?
And this was even hard. And I shared this with you also. And my husband probably won't listen to this episode, so I can talk about him, but I'm just kidding. But he was someone I also had to kind of convince on this, like that this was important, because he's like, wait, what do you want to do? You want to cut what in his mouth? And like,
Yeah.
want to do myofascial therapy. I had consulted with other dentists who had said, we wait till children are 6 or 7 because they're just more compliant with the exercises. And I can see why, although with William, he might need orthotropics, he might need some other things. And I wanted to get the ball rolling. And I thought he was very diligent with his exercises. So per year and your husband's, recommendations, he was ready to proceed. And so I'm glad that we did that. But this can be, I can't even imagine with each age group and just assessing if the children are ready and how long, but we did exercises for months. I mean, it was
There's no
months.
cookie cutter approach to that. There's just certain skills, again, like I would say, like proficiencies that you'd like to see before you say, yep, now we're ready. And when you see those certain things achieved, that procedure can be very successful, you
Yep.
know, and that procedure is still, I mean, no one takes lightly that you have to say that a procedure needs to be done. But I think
Yep.
I shared this with you when we make those, when I, or my husband or, you know, other, we make those recommendations, I always say, I really want to do this one time. I mean, I'm a mom too. And I don't want to tell, I don't love telling parents, like, I really think a procedure is needed, but if a procedure is needed, then let's make sure our timing is right. Let's
We're
make
going to
sure
be successful.
that
Yes.
we're being successful. Yeah. I
Heck
don't
yeah.
put
I want to go
anybody.
off on another tangent here real quick, and then I want to come back to just kind of consequences of mouth breathing. But in your bio, which I haven't talked to you a lot about this, although you did recommend, William use his munchie, but you are a certified myo munchie practitioner.
Yeah,
Kind of sounds silly, myo munchie.
I know. It's
So
a fun name.
can you tell the listeners what that device is and kind of
Yeah.
what its application is?
So it is a myofunctional chewing appliance. So it is a tool we use in conjunction with therapy to support all those goals we already talked about. So lip seal, nasal breathing, tongue posture, and swallow. It's an oral appliance that was developed by a dentist for oral hygiene reasons, you know, something to help clean the teeth and help support the gum tissue. And what he was finding is that he was getting, you know, some other benefits, you know, dentally, orthodontically, myofunctionally, like he was seeing dental arches, like kids developing a little more spaces in between their teeth. And so he was understanding that, again, the muscles support that growth. Like you need
Mhm.
work, and chewing is a super important part of the work to get the dental arches to grow. So
And
it,
strengthen the jaw too, right? I mean, it doesn't,
right.
I don't know I don't remember because we ordered ours so long ago, but
Yeah.
chewing on that for 5 minutes, isn't that like supposed to be, simulating a 30-minute meal or something?
Yeah,
Like, isn't,
it's you, yep, 10 minutes. We try to get patients to do 10 minutes 2 times a day. I will sometimes, like I said, depending on where we are in therapy and how easy some of those skills are, we can dial that back or, you know, according to what they need, but 10 minutes 2 times a day. And if you use it, they make adult appliances too.
Mhm.
Everything requires work. You got to work a little harder to close your lips around it. You know, there's a spot in there as well for you to aim for, back to tongue elevation and how to get it up there to promote elevated tongue posture during swallow. And the act of chewing, I mean, to be honest, that's whenever we talk about myofunctional therapy, nothing we do right now requires a whole lot of work, even with our littles. You know,
Giving them
when
all soft food and
it's
yeah,
all
yeah.
soft and processed and nothing requires a whole lot of work. And that's the chewing piece of it is a super important part for growing the mandible, the jaw down and forward. So the baby munchie starts as little as 6 months.
So you
So
have to
that's
order a specific like size per age.
yes,
So just
yes. And
FYI
the
for the listeners, and I'll
company,
put this link in the show notes, but yeah,
yeah,
continue.
yes, exactly. The company has, like, for the infants, so the 6 months to 18 months, they do have you order from a certified munchie practitioner because they do recognize, like we
Mhm.
talked about too, like it does require some guidance. You know,
Yep.
some people will take to it, some people will not. And again, I always tell patients, that's a great place to start, but if it's not that easy right away, that should be a little red flag to tell everybody, okay, this wasn't quite as easy as I was hoping it would be to just, you know, pop a chewing appliance in and get going with it. So that usually tells us to, like, look back a little further. Is there a tie we're missing? You know, is there something that's pulling? Lots of patients with the lip restriction, when you go to close, it's harder, right? It's
Uh-huh.
more effort to close, or they'll start to chew with it for a little bit and it rubs. But it is a beautiful appliance to support all those goals for myofunctional therapy. And that's why we utilize it
Yeah.
a lot with our patients.
Well, I just knew William needed to develop. I knew how important, developing that jaw muscle was for William. So
Mhm.
before I even started working with you, I had ordered him a munchie. I think our dog like got the first one.
Oh, anything
Anything
that
that's
smells
silicone,
like
she'll,
them.
yeah, that's an expensive little treat there. So we
Yes.
ordered another one, but so William worked with that. Then he worked with you. He ended up having his releases done, I don't know, a month or two ago, or so, I don't know, time's
Yeah, I
flying
think
by.
we're getting close to that. Yeah.
Which, as his parents, I felt like it was pretty traumatic on on us,
Mhm.
but it was very
Yep.
simple. It only took a few minutes. So they did release the tongue and the upper lip. He was very strong, very brave, went in for his procedure. He cried on the way home, but he knew
Yeah,
what
he
was coming.
did.
He kept saying, Mom, when am I going to get this thing cut out of my mouth? Like he knew
Yeah,
what,
yeah.
what, what our
What that
goals
was.
were.
And sometimes
Yes.
too, to get even as little as William is, like,
Yeah.
4 or 5 years old, they start to understand once they're doing some of the exercises that it
Yep.
pulls or it
Yes.
tight. So yeah, I'm always surprised too when patients, young parents or young parents of young patients will say something similar to that. Like they're like, this is kind of now more of a nuisance. They're noticing it as they're trying to do the
Well, now
things.
he's looking at everyone else's mouth, like grandparents, like looking to see if anyone else has a tie. But,
Yep.
but
Once you see it.
following his releases, you then really had him step up his exercises. It was like 5 times a day for several weeks.
Mhm.
Um, and again, that's to help these not grow back, essentially, right?
Yeah.
Because the tissue essentially it's scar tissue, and it can grow back. And so even like I remember one exercise you had him do was put the noodle under his lip to kind of stretch that out. And you manually, after the lip
And I
release, you
have to
had him,
rub.
yes, and do these up, out, down
Yep, mostly.
exercises. Yeah. So those, I think those were, yes, very
Yeah, and
important.
like I said, when we talk about like doing a release, I always tell patients, you're going to replace that frenum with a scar. So A, we want to make sure we're ready. B, we want to make sure we need it, right? So,
Yep.
and the doctors that, I work closely with too, we make that decision, like, can we actually improve the range of motion by doing a surgical procedure? Because if we're going to do a surgical procedure, we're going to have a scar. There's no way to not do that. So we do the stretches to, have the scar heal as thin and as flexible and as mobile
Yes.
as
Yes.
we possibly can, so that the range of motion and the function is better than where we started.
Yep. And
And
I think,
it takes time.
and I think we're already there with William. I mean, again,
Yeah.
I can already see just he can close his mouth better. When he climbs in bed with me, he's not sounding like he's, like snoring.
Yeah.
Like they're just
Everybody
little.
does
So
it.
little changes we've already seen. But again, this is with the ultimate goal of helping again to develop his airway and help him not have crooked teeth and not mouth breathe. So let's
Mhm.
go there. So
Yeah.
we kind of already talked a little bit about this, but I really want to expand on why nasal breathing is so important, right? You want to breathe through your nose and kind of
Right.
what the consequences of mouth breathing can be. So can we
Right.
go back and emphasize that a little bit?
Yeah, yep. So we start by saying your nose, everything has a function, right? Everything has a purpose. Like your nose is no different. So it contains all the things you need to be your body's filter, your first line of defense against
Yeah.
everything you're going to breathe in from the outside world. So it has hair, it has mucus, it has nitric oxide gas, which again is only produced in the maxillary sinuses. So if you skip breathing air in through that filtration
Yeah.
system, you're missing all those benefits of nitric oxide, vasodilating, naturally antiviral, antifungal, antibacterial. So you're cleaning that air, you're warming and humidifying it before it's brought into the body to use. So mouth breathing, you're not getting any of that. And things are coming in unchecked. And when stuff comes in unchecked, inflammation happens, somewhere, something else is going to pay the price for that, those allergens, those viruses
Mhm.
that is coming into the body. I tell people it can swollen tonsils in kids, swollen tonsils, swollen adenoids, recurrent respiratory infections. I mean, generations before generation, hundreds of people known like closing your mouth keeps
Mhm.
you from getting sick.
Mhm.
So, all of those things that come in are more likely to create problems, recurrent respiratory infections. There are even long-term mouth breathing to gut health issues. It is the top of your GI system. If things are unhealthy and inflamed, and then it just continues down that path too. So yeah, it's important to breathe through our nose.
As part of my quest in again convincing my husband that this procedure was necessary for our 4-year-old, this elective procedure, right?
Yeah, absolutely.
I
Yep.
I just
I get
kind of
it.
I went to Cleveland Clinic's website and just kind of Googled like mouth breathing. I mean, just I'm just doing little searches to see like where can I get some information to send to my husband. And so this was more in relationship to adults, not children, but it's the same thing. So even Cleveland Clinic says some examples, right, of how mouth breathing can affect children and adults include dry mouth, which makes total sense, right? If you're breathing through your mouth, especially at night, your whole mouth can dry out, right? Going to dry out your saliva, bad breath for sure,
Yep.
drooling on your pillow, which maybe you don't care about, nasty bacteria, malocclusion, mouth face breathing. So if you Google that, you don't want your children's, how do you
Those muscle
facial development?
memories, right? Yeah,
Yeah,
you start to
like
see the skin start and the narrow jaws.
the Napoleon Dynamite look, like that
Yes.
sort of face,
Right.
right? You don't want your cute child
Nope.
eventually to look like that sort of mouth, have that mouth breathing face. And
Yeah.
even I was surprised, but it makes sense that mouth breathing can lead to hypoxia, which can like lead to behavioral problems. So even ADHD, right?
Mhm.
If you're a
Yes.
parent struggling with a child, you might think, are they getting oxygen to their brain at night,
Yes.
or
Yeah.
not? And stated another way, again, this is my specialty, but I read the book Breath by James Nestor. I don't know if you've read that. I read it years
Yep.
ago on the beach, and I was like, I
Yep.
kept telling Eric, oh my gosh, this is so good. You have to read this.
It's so good.
Yeah. He talked
Yeah,
about
put
a
the link
lot
to
of,
that one too. People should read that.
yes, I will. I got to write that down. I will put a link there, but he talks about lots of things in the book, only one of which is the importance of nasal breathing. So he talks about when mouth breathing, your cortisol can spike, which again, I didn't kind of put two and two together until I had heard him say that. Your heart rate variability can plummet, your blood pressure can rise. And then, just like you said, the air is left unfiltered, which can lead to sinus infections, snoring, fatigue, irritation, anxiety, all
Yeah.
kinds of things,
Yes.
which I think the layperson, again, just wouldn't necessarily link at all to their
Absolutely.
child hanging, their mouth open.
Yeah.
So,
And all that stuff, we talked about it's the mouth breathing and the lack of oxygenation, but then when they go to sleep at night, they're supposed to be, hitting all these phases of sleep have a job to do
yes,
too.
yes.
And if they're fighting to stay oxygenated all night, they're not getting all the benefits of the REM sleep. They might not be getting enough REM sleep.
Mhm.
They're not getting the benefits of deep sleep, which is one of those things. Bedwetting, ADHD,
Yes,
all
yep.
those signs are big red flags that your kiddo's not getting all those phases of sleep and oxygenating properly in all those phases of sleep.
Yep, good points. I think this is also why kind of the rise to mouth taping has become so unpopular, or
Yeah.
so not I meant so popular
Yes.
to help adults to kind of learn to breathe through their nose. Are you a fan of mouth taping? Is that, I've never really
Oh,
talked to you about this, so I'm putting you on the spot,
yeah.
but
No, I love this. I always tell patients, like, I love a good biohack just as much as the next person. Like, I love something that's like, this is gonna make me feel better. Then yes, let's do it. The deal with it is it is not safe for everyone. Not everyone out there knows that
should be
they're
doing that. Yeah.
is open. And if you don't know, your mouth breathing, sometimes that's your body's rescue way of breathing. And if you cut off your body's rescue way of breathing and something is obstructive, so, your nasal passages are not open, and that can be inflammation, or it could be structural. If you have a hard deviated septum, if you've got, giant turbinates, if there's an obstruction, or back to if you are severely tongue-tied, if your mouth is super small, if that airway space is obstructed and now you've cut off your emergency way of breathing, then that person, now you've created a worse situation when it comes to sleep and oxygenation. And your mouth is meant to be your rescue breathing. So for the patient who has an open airway and it's a habit, and you taped them shut, then all of a sudden they feel fantastic. I mean, fantastic, because it does. They feel oxygenated, they feel rested, they feel great. And they tell everybody that, and that's wonderful, but it is not safe for everybody, given if there's,
So
and
should
it's,
they be evaluated first to make sure there is no obstruction? Is that kind of what you're
yeah,
suggesting before you just go taping your mouth shut? Okay. But
yeah.
generally speaking, the concept, okay.
Yes, absolutely. I always tell everybody, I'm like, yes, I love something that makes you feel better just as much as anybody, but let's make sure your airway is open first before you try it.
Sure. How else could adults learn to breathe through their noses other than that hack? Or is that where, again, even adults could work with
The
you?
Yeah.
Yeah. Yeah. Okay.
The awareness part of it, and then both honestly, everybody could benefit from some form of nasal hygiene right out of the gate. One of the things we talked about early on in
Yep.
therapy was some form of nasal
Yeah.
rinsing.
Yeah.
And patients usually save that for allergy season or if they don't feel well. But in essence, you should be cleaning your filter. You clean your filter in your car, you clean your filter in your house,
That's
like
a good
you
one. Yep.
brush your teeth to prevent cavities. Like you should clean your nose to keep you healthy and aid in opening your airway space. So that literally you can look like just your basic nasal saline rinse. It can be a neti pot for those patients that, have more allergies. There's all kinds of products out there, but everybody could benefit from some kind of routine nasal hygiene
I like
protocol.
the saline ones, but also what's the xylitol? The xylitol one is
That's
X clear.
clear.
Yep.
Yeah,
That's a good one
yep,
too.
it is for sure.
I was going to ask next, what is sleep disordered breathing? But you keep alluding to it. But like,
Yeah.
would you say snoring is sleep disordered breathing? Like,
Yes.
what?
So everybody always thinks that that's, so it's kind of that blanket statement because sleep apnea obviously is the biggie, right? That's
Yeah.
the one everybody really truly understands, that there's a whole slew of whole body health consequences that come with a fully obstructive airway. But there are multiple kinds of sleep disordered breathing that are still not functional and still not optimal for health that happen before that airway completely closes or collapses. To get an apnea diagnosis, that airway has to close or collapse for longer than 10 seconds, more than 5 times an hour. So
Have
that's
to
a
be pretty
lot.
bad. Yeah.
That's pretty bad before you actually get an apnea diagnosis. And even there's mild, moderate, or severe, depending on how, are we talking just 5 times an hour? Are we talking 95 times an hour? So there's still severities within that. But before that airway even closes, there's snoring. Snoring is the sound of your airway closing. And, patients think that, it's normal because everybody has it, or it's common, and so if everybody has it, then it's got to be okay, right? Because everybody snores, or so many people snore, and in essence, that is the sound of that airway starting to close. So that's your first clue that there's not optimal oxygenation or sleep happening. There's even a form of sleep disorder breathing called upper airway resistance. That oftentimes, that was my story. So your upper airway, so whether, back of the tongue, can start to close or collapse, but your body will compensate and do what it needs to do to help keep your airway open. So you may clench or grind your teeth, you'll wake yourself up, you toss and turn. So what it does is your body's protecting you from actually getting apnea, but it's not letting you get into deeper phases of sleep because your body ultimately knows if you went into REM or deep sleep, your airway would close. So oftentimes you'll see, people feel like they know they don't sleep good, right? You're in bed 8 hours or more, you wake up exhausted, there's still brain fog, I was always the queen of energy drinks. Like I loved one just as much as the next. I had coffee all day long. And if you asked me, I'd be like, yeah, I sleep great. You tell me to fall asleep now, I'll show you how good I can take a nap. But it wasn't sleep apnea, right? There really even wasn't any
Right.
snoring. But when I finally did have a sleep study, what it showed was a ton of sleep disturbances and little to no REM sleep. So that would be considered more of an upper airway resistance diagnosis because you aren't getting any REM sleep, you're not getting any deep sleep, you still feel awful, but you're not sleeping or breathing properly. So that's just something that is still considered sleep disordered breathing, but isn't associated with, like, it's not full on sleep apnea.
You got me really thinking here. I mean, obviously, I'm not going to put an aura ring on William to, like it would have been nice to see the before and after, like sleep
Absolutely.
cycles. But what you have me thinking on now is for my patients who come in who literally tell me they're already tracking their sleep and they say, I'm not getting good REM sleep, right? And my initial thought is let's optimize their hormones and give them, supplements to help with
Yeah,
sleep
and
and
this is
whatnot.
where you and I talk, like, there's
Yes.
more ways to
Yes.
there's more reasons why it happens, and that's why we should, collaborate and work together on patients, because there is that functional reason as well.
Well, now I'm going to be looking for things like ties and just and more just assessing as I'm talking to them that what do you call it, resting oral posture, or they're just other
Yeah.
things that I'm more aware of now, right,
Right.
that then could be addressed to
Mhm.
help
Yep.
improve their sleep, essentially their oxygenation, improve their REM, deep sleep, whatnot.
Right.
So
Around with
so let me
that.
go back though again to how myofunctional therapy can help with that. So those adults, like I
Mhm.
keep coming back to ties, and I know I'm kind of because that's kind of our story, what led us,
Yeah.
your direction, and come to
Right.
find out, Eric's grandpa. So
Mhm.
William's grandpa was saying
Yeah.
that his dad, so William's great grandpa, Eric's grandpa,
Yeah.
had a tie that was never released, right? And I mean, he is far gone. I think he would have been 110 or something by this
Yeah.
point if he was still alive. But it's just interesting to kind of hear that and to hear, generationally, I think some things just didn't used to be addressed. And obviously he still grew to a
Yeah.
healthy,
Yes.
life, healthy
Mhm.
age. So I keep coming back to at what point, and we haven't even really, I guess, mentioned what tongue and lip ties exactly are. So maybe we should define those at the end of the show here. But how do you decide which need released? William had a stage 4, so obviously his was bad, and his tongue needed released. But can you maybe let's go there, define tongue and lip ties, and then the question is, does everyone need them released? Because
Right.
the other question I keep coming back to is, would myofascial therapy help a lot of those in the absence of the release, right?
Yes.
So can
So
you, that's a long, big,
yeah,
twisty
yeah.
question. Can you answer that?
Yeah, yeah. So it comes back to those goals. So
Yeah,
sometimes you will look and there's severities, right? So there's different ranges, and there's sometimes you will look and that severity is so bad. Like the range of motion is so bad. There's no amount of stretching that's going to stretch them into good normal range of motion and
sure.
function. But ideally, it all comes down to, can you do those goals? Can you breathe through your nose day
Mhm.
and night? Can your tongue fully rest in your palate, not just the tip, but can the back of the tongue get up there? And then the key is stay there. When you relax at night and those muscles are not flexed, does it stay there? Can you keep your lips together, keep your tongue in the roof of your mouth, and breathe through your nose? And sometimes we, even as therapists, are like, how does that look? If the muscle tone is, you can tell somebody is weak and uncoordinated and there's a lot of compensation. You start with therapy and then you reassess later. When those goals cannot be achieved, that's when we start saying, okay, is this frenum? Everybody has a frenum. Not everybody has a restrictive frenum. So we all have frenums. You have an upper lip frenum, you have a lower lip frenum, you even have buccal frenums, and you have that frenum under your tongue. Um, they're there for stability's sake. Okay, so they are a normal part of anatomy. They can be restricted to the point that now we're impinging on function and range of motion, what we want to do. And ideally, that's what we want. And so we start with the therapy, we reassess that range of motion. If we think something is not functioning the way we want to because it can't stay there, because it can't do that, because you think of an elastic band kind of pulling, and so it can't easily do it, and it can't do that, then we start talking about releases. And like I said, then it's real important to find a good provider that does a lot of them, and they feel confident too that, like I said, we can do this procedure and we can improve the range of motion by doing a procedure, not just do a procedure to do a procedure,
Right, right.
and you can get better function out of it.
Good, thorough answer. Okay, so well, my last question is, what ages can benefit most from this therapy? But it kind of sounds like potentially everyone could. It kind of depends on where they're
Yeah.
at.
Yep, yep. My youngest patient, 6 days old, and my oldest patient right now currently was 73. So
Yeah,
it really
quite the
does
range. Yeah,
yeah, it really does come down to, the therapy first, that function part of it, and then the release is a tool that gets you to those goals if
yeah,
it's needed. Mhm.
sure. We covered a lot. Is there anything else that you do on a daily, weekly, monthly basis that we didn't really get to talk about that you want to share? Anything else to emphasize?
I don't know. I have one patient, every time I give her exercises, she's like, you have the weirdest job. I said, yep, I have the weirdest job.
Well, so for instance, you have William do cheek puffs, and then,
Yep.
tongue in cheek and, all these just different exercises that are kind of funny, but yeah.
Yep, exactly. Yep. So every time I give her, she's like, you have the weirdest job. I'm like, I very well might have the weirdest job.
Do you also like when you're on a plane, are you that person that's like looking at again oral
You
posture and are
can't,
you
you
can't
can't
help
help.
not see?
You
Yeah.
can't help. No, you do
Oh,
once you know, and like I said, you sometimes I see you, you're just like, I know that little one doesn't sleep good, like
mm.
that, or that person, like, oh yeah, I'm pretty
Just want to
sure
help them. I slip them a
help you
card.
sleep
Yeah.
a little
Yeah.
bit better.
Yep.
Yeah, for
Well,
sure.
tell us again. I kind of opened the show saying you had this dental practice with your husband, but tell us kind of the name of that, where that is, your website, also
Yeah,
your
yeah.
myofascial therapy business. So tell us where listeners can find you, kind of website, social media, all that jazz.
All that stuff. Yeah. So Anderson Dental is my husband's practice in Davenport. So I always say when you're looking for an airway focused dentist, think structure, right? Because they're going to be looking at, the tongue and the jaws, so the hard structures and things. My business is Myomatters, so myofunctional therapy. We do most of our therapy online. Our pre-crawling kiddos can be seen by my daughter at the dental practice. So Myomatters is our website. You can schedule free consultations right there from the website, Instagram and Facebook. But we post a lot of information. Back to like educational pieces. That's as a dental hygienist, that's what we did anyway. So I do feel like it's important to like educate and get the word out there. And I feel like social media, that's the good part of that does. So there's a lot of education out there on our Instagram.
I didn't pre-warn you, but I ask all my guests their top longevity tips. So as we wrap up the show, if
Yeah,
you had to pick one thing, and you can re-emphasize what we've already talked about this entire show if you want, but what's
sure.
your top longevity tip?
Breathe through your nose.
Not your mouth. Yeah.
Not your mouth, for real.
So can you, I know this is like the $1 million question, but okay, so true, I get that. Are there any quick tips for listeners?
To breathe through,
To,
there's
yeah,
honestly
yep.
just checking in consistently to see where your breathing is coming from. And that nasal hygiene, if those two things get you thinking about your nasal breathing, that in itself will make a huge difference.
Love it. Yay. Well, this is an interesting show. Thank you for coming on today
Yeah, this is fun.
and just sharing with my listeners the importance of oral posture and myofascial therapy. And thank you for helping my son and just raising awareness on this topic. It was good.
Oh, my
Different
pleasure.
topic, but very important. So thank you for your time today.
Thank you.